area impacted was close to 34 times the size of the Lake Albert. Imagine if it happened here, the impact it will cause. So what are we doing as UNOC to manage the impacts I've elaborated above? Now, there are 3 levels of intervention. The first one is at corporate level, and the second one is at project level. Now, at corporate level, we've put in place an environmental policy. Now, this policy is simply a commitment by UNOC from the top level, the board level, towards environmental protection and biodiversity conservation, compliance with national environmental laws and industry standards, and commitment to efficient utilization of natural resources, for example, water, and commitment towards climate change mitigation. As a way of fulfilling these commitments, UNOC has put in place procedures and guidelines. For example, we've put in place the risk assessment procedure, which helps us assess our risks before we undertake any activities.
UNOC, your partner in Uganda's oil and gas sector.
From here at UBC Broadcasting House from Nile Avenue, on Nile Avenue in Kampala. My name is Charles Odongtho, and we are back yet again for this edition. This week we are going to be taking a look at the COVID pandemic and its impact on the socio-economic and political lives. We are joined by probably the best persons to be discussing this topic. Let me start by saying that we will be joined by our colleague, our panelist, Honorable Margaret Muhanga, all the way from Fort Portal through Zoom. But in the studio, I have Ramadhan Gobi, an economics lecturer at MUBS, or the Makerere University Business School. He's right here with us. Gobi, you're most welcome back.
Thank you, Charles, and good evening to our viewers.
We are missing Abdu Katuntu. Honorable Abdu Katuntu today is not feeling well. I pray that it is not COVID. Honorable Katuntu must be watching, and I told him I'll be praying for him, that it is just common cold. The weather has changed, but we will be missing you indeed, Honorable. But our guest, the main guest, the Honorable Dr. Ruth Jane Acheng. She is the Minister of Health herself, and the lady who some people call Mama COVID. You're most welcome, Honorable.
Thank you very much, and good evening to you all.
And I was told, the latest I was told is that you have now changed status, that you are now also a candidate for Lira district.
Charles, I'm actually a candidate for Lira City.
Oh, for Lira City, true. Oh, that must be emphasized. We are also expecting the Honorable Ibrahim Semuju Nganda. He confirmed about an hour ago that he was in traffic, terrible traffic today, but he confirmed that he will be joining the show, and we are going to have this discussion fully with him, and he's MP for Kira Municipality. As and when he joins us, he will join us from that point. But the discussion must begin. We're not going to keep you waiting. Let me start by asking Honorable Jen. The last I checked, our last update yesterday, 9 people dead, and I think about 300,000 testing, cumulatively done. Where do we stand in the fight against COVID? Are we winning? Is the fight too big for this country? Are we going to win it? What are those measures that are working for us as a country?
Thank you, Charles, for those questions. The COVID-19 pandemic is still growing worldwide. If you look at the global situation reports, the trend is that on every continent, the cases are increasing. And the cases will only begin a downward trend when people take it upon themselves to practice the preventive measures and adhere to it with good compliance. In Uganda, we have nearly 1,313 confirmed cases among the Ugandan population. But if you consider the other people that we have screened at the border points that we did not allow into the country, we would be recording over 3,000 cases. However, from the time when we recorded the first death, the number of deaths have been increasing. To date, we are at death number 10.
We got another one today.
Yes, we did. And the numbers will continue to grow unless the population of Uganda realize that we have danger in the house. I don't want to say we are losing the fight, because we have put up a very good response to the COVID-19 pandemic based on our experience from controlling previous epidemics within the country. And so building from there, we have had a sustained response that has been majorly focused on prevention, but also identifying all cases and getting them treated early. However, with the first lifting of the lockdown, it gave opportunity for otherwise hidden cases that could have been in the hotspot districts to start infiltrating other districts as well as the city of Kampala. And so today, Kampala has joined the hotspot districts. And that is not good for us, because Kampala is a business city, but it's also large. The population varies during the day and during the night. And so it comes with a lot of complexities that requires us to tweak our response a little bit and begin to intensify efforts in this metropolitan area. I want to encourage the Ugandans that the direction in which this pandemic will go in this country will be determined by the population. If we are responsible people, we will keep it under control. But if we become irresponsible and careless, then it may blow out of proportion and cause us to lose some good number of lives.
What must the people do? The ordinary people. I will come back to you, the politicians, later, but what must the ordinary person do?
Each and every one of us must adhere to the standard operating procedures. Evidence has shown that face masks work. Countries where people have consistently worn face masks while in public and in other places where they've gone to, the pandemic has been under control. Social distancing works, because then you don't get into contact with people who may be potentially infective. Washing hands and use of sanitizers, very cheap measures, work. And people need to adhere to all that. But also, in addition, it is necessary for us to avoid movements that do not add value to our lives. What do I mean by this? Why do we have to go to the city center if you don't have to? Stay at home and minimize your movements. In that way, we will be avoiding contact with each other, which is what predisposes us to COVID. Of course, taking into consideration the modes of transmission.
But someone, you have talked about what the local person must do. But we have seen the difficulty that is now being caused by you, the politicians, that because of the abnormal times of elections and the fact that elections hardly can be done minus interaction, that the politicians are now the ones who are in the lead of breaking this.
Charles, you're absolutely right. It is a difficult season that we are in, and we take note that the candidates have to engage with the electorates. It is we, the politicians, who have primed the population in that way. And it is up to the leaders to prime them right now in the direction that we must go. The people out there look up to the leaders for guidance and for direction. So if you move to the population without teaching them about COVID and you just mix up because you're looking for votes, then you're not being a responsible leader that cares for the people. Evidence has shown that in countries where elections have taken place without careful thought about the preventive measures, we have ended up losing candidates and losing people, even after elections. It is true, we have seen the trends that is currently going on. Personally, I have written to all party presidents about this election period and the need to adhere to the standard operating procedures. And I have requested them to cascade the message down to the last person. Beginning with themselves, they must adhere to the procedures. The Electoral Commission has provided guidelines. The different parties have provided guidelines that we developed with them together with the Scientific Advisory Committee, clearly highlighting what must be done when you are engaging with the electorates. In the guidelines, for example, you are allowed to meet with about 70 people, well spaced, out in open air. However, it may not be possible down at the grassroots because people begin to crowd. So you have to look for strategic venues where you can hold such meetings without having a big crowd. The difference with this is that you will have to host many more meetings. It may be a little more expensive, but it is cheaper when it comes to the cost of life.
Good. We have been joined by Honorable Margaret Muhanga on the line through Zoom from Fort Portal. Honorable Margaret, you're most welcome to the show. Can you hear me? Can you say hello to your viewers?
Yes, Charles, you are loud and clear.
How is Fort Portal doing?
Fort Portal is all right. It's raining and it's cold.
Good. I'm going to return to you in a bit after Ramadan because I like where you are right now, the situation you are in, the campaigns going on, and you are deep. Yes, it is a new city, but that's the announcement. The fact is that the lifestyle in Fort Portal or Kabarole is largely a village lifestyle, rural, and people are mingling freely, and we want to get that testimony from you on whether the preventive measures that the Honorable Jenna Cheng is talking about can work effectively. Let me come back to you in a bit. Mr. Gobi, you have had the minister, in her starting statement that the success of our victory against COVID will depend on the responsibility and not carelessness of the people. And you have had her also respond to the challenge we have of the political moment and also the political activities going on. Do you agree with the measures that are in place to the extent that they must be effective as they are now?
Thank you. First, I would like to thank the minister for the leadership she has given her docket during this period. I'm one of her fans in that area, and I remember we were among the first people she met at Serena. I think we were at Serena.
You as lecturers or as experts?
With the private sector people. Sometimes when I'm not teaching or with you, I'm talking to some people in the private sector.
Moonlighting with the private sector.
Absolutely, and she's the one actually who opened our minds as far as COVID is concerned. Everybody was complacent, and not even complacent. We were a bit not feeling the reality that COVID was real at the beginning. And she came and with her ministry officials, and she gave us a very good talk on COVID. And I want to tell you, since that time, my mind has been very well focused on this battle. Secondly, I think as government of Uganda, I would want to agree that they have been very open and decisive in the fight against COVID. Because our country is structured in such a way that it's quite difficult to social distance, first and foremost, especially here in Kampala, where people are doing business in an informal setting. But the way the head of state and the entire government defined this challenge, and the SOPs which they put in place, those standard operating procedures, and the kind of sensitization which went with it. At the beginning, when people were a bit not actually taking it seriously, they all of a sudden, I saw people taking it seriously. But then, a choice had to be made somewhere in the middle after the lockdown, because Uganda had one of the, or we have had, and we still have, some of the strictest lockdowns in the world when it comes to the measures which were put in place. The way the businesses were stopped, and even us, being at home, the schools closed, the churches closed, and so on. We are among those countries which have been very strict. I think it has had a kind of a total impact on the people. And all of a sudden you see when they started releasing gas, gradually, I see complacence back. That many people now, when they're moving around, they are not wearing masks. You see about 2 in 10 people having a mask in Kampala here.
And they are close.
And they are close to each other. I see people hugging, and as if we are back to normal lives. And I thought the government needs to come in again and remind people, so that we don't wait for such a moment when the cases will, resurge again, and then they take us back to lockdown. If Uganda goes back to lockdown, it will have a very devastating impact on the welfare of people, because
is it any less devastating now on especially the economy, on business?
Of course, business is down. The economy is down. I've been a part of a team which has been analyzing the impact of COVID. Minister of Finance hired an international firm to do this analysis, and the firm now hired some of us to help them to contextualize the analysis. When you look at the numbers, they are really
Ministry
bad.
of Health hired an international firm.
No, Minister of Finance.
Ministry of Finance.
Yes.
Hired an international firm.
Yes.
And the international firm is now using local expertise.
Yeah.
That's interesting.
Sometimes,
but we will come back to that.
Sometimes those are the
Why didn't they hire you directly?
I'm not the person.
The hiring.
Absolutely.
Please go back to your point.
That question will
proceed
be
with your point. But
so the point I was making is this:
caught something interesting.
That when we look at the numbers, the GDP, the way it's likely to to drop by 7 percentage points, even at this level where we are now, with the virus largely contained, and most of the impact coming from the region and the global, impact. with businesses, especially in the sectors which are difficult to social distance, like tourism, like transport, like the, retail trade, and so on.
Health itself, the entire chain of the health sector, treatment,
actually
hospitals.
Social services.
Yes,
social services
generally social services.
Health, education, and social development. We are looking at actually this calendar year having either 1%, if we are so lucky, growth of the economy. From a projection, earlier projection of 6.2% to 1%. And if we are not even so lucky that these now cases which are resurging start now to affect especially the area of health, and then force government now to slow down on the reopening of the economy, then we are likely even to hit 10 percentage points in the drop of GDP. And who's affected most? In our analysis, we see it's mainly the SMEs, because they are the ones which, first of all, are operating in the informal setting, very difficult social distance, and also they rely a lot on the large corporations.
Someone might be asking, what are SMEs? The small and medium
enterprises. Yeah. Actually, including the micro, those which are employing from 1 to 5 people, and those who are employing from 5 to about 50 people. They are the most vulnerable in this case, because they are nowhere amongst the essential, these essential services. They are the ones which have been under lockdown, and in any, unlikely event that there is a resurgence of the virus and we go back, and I'm sure the minister will not hesitate to advise government to take us back to lockdown. That's why Ugandans need to be very careful, such that we do not, at any one point in time, be taken back to where we were in March, April, and May.
That's a point that the Honorable Minister should clear the air on. I've seen so many exchanges, worries on social media, people saying we are about to be locked down. The moment the death reached 10, this and... Honorable Minister, are we going to be locked down again? What are the telltale, signs that at this point we cannot, that the government cannot succeed in stopping the spread or stopping the death, and that we must curb it through these hard measures?
Actually, Charles, with this pandemic, lockdowns are unavoidable. Even up to now, we still have some districts locked down.
Which ones are these?
Nearly 10 districts are locked down. Majorly the hotspot districts like Amuru, Ajumani, going up to Yumbe, go down to Chotera, Rakai, Buikwe, Namisindwa. Those districts are locked down.
Why are they still locked down when the rest are open?
Because the numbers of infections that we get from there on a daily basis are quite many. And if you leave the population there to move freely, then the infection will spread. So what we do with such pandemics are what we call either geographical lockdowns or total lockdowns. So when we identify an area and the rates of infection is going up at a rapid rate, then we implement a lockdown to enable us concentrate our activities in there until the rates of infection start going down, which has done very well for Chotera district, and it has also done very well in Amuru, which were some of our hot spots. Now, a city like Kampala is a very complex area. When you get an infection in Kampala, it will spread like wildfire down to Wakiso, Mukono, and the entire metropolitan area. That is why the people of Kampala, and of course the rest of Uganda, need to be very careful to follow the preventive measures. Nobody wants anyone locked up, but the situation may dictate the need for a lockdown. Otherwise, if we reach numbers that are not manageable. Imagine if we are admitting 1,000 cases a day and we don't have enough bed space. The 1,000 cases, each of them will stay for about 14 to 21 days. That means some people will have no bed space if they fall sick. So you have to reduce, or what we call suppress transmission, to allow, for numbers to be managed. And it is in such cases when you start getting mass deaths. So it is important that the population of Uganda understand that our death rates have been low and slow because of the manageable numbers. The other flip part of it is that the health workers will get fatigued. We can't afford to have many people. Once the health workers get fatigued, they pay less attention to each patient. Now, imagine a situation where you have 200 people in intensive care unit, and each person is being accorded a few minutes. That is not good. So at all costs, Ugandans must ensure that we adhere to the preventive measures, keep the numbers low, and the health workers motivated. That's the only way we'll avoid a lockdown.
Talking of healthcare workers, have we so far managed to protect them and to keep them safe? The 10 deaths, there is no health workers yet.
No, we have not had the death of any health worker. We have had infections. And
how many health workers are now infected to date?
To date, we could be having numbers like 35 health workers.
Wow.
Yeah, getting infected. But they have all improved, and we thank God. We don't want to have any mortality of any health worker. That would be very demotivating.
Okay. I'm coming back to you, Honorable, but the line, the connection is a bit shaky. But I am told by my producer that Honorable Margaret is back online. Honorable Margaret, are you with us? Honorable Margaret Mohanga.
Hello, can you hear me?
I can hear you. I can also see you.
All right, that's good.
Good. Speak to us. Honorable Margaret, what's your experience with the campaigns? Are you following the, in the course of your campaigns for the primary elections that are coming, are you following the standard operating procedures? Are you following the preventive measures? Are you social distancing? How possible is it? Be honest with us, because this is not just a health problem, as experts have said, but it touches right into the social fabric, political fabric of our daily lives. And so candor is needed for us to think about measures on how to curb it. So are these measures possibly able to be acted upon, or it's really difficult, practically speaking?
Yes, Charles, I think it is very difficult to ask people to social distance or even to wear a mask. Because I have seen people who even have masks, but they wear them the wrong way. And yet there are those who do not even wear them at all. They keep them in the pocket. You remind them, but why are you not wearing a mask? And then they pull it out of the pocket. And the others who wear them on the chin. The mouth, the nose, and the eyes are all out. Now, because of the campaigns we have tried, it is upon a specific candidate to make sure you meet people where they can social distance, that is outside, to make sure they are a little fewer, but it is extremely difficult to tell them to sit apart. That one I'll be very honest. Even when there is a lot of space, people come together and start whispering to one another with their masks on the chin. And also, if you ask them to wear masks, they say, where are the masks? We have been waiting for the government masks. And so people look for all sorts of excuses. But the campaigns aside, there are so many social gatherings, other social, especially barriers. that's where I am seeing the next spread coming from. I have been tweeting, I think I've tweeted like 2 burials I've attended. And they were attended by over 4,000 or 5,000 people. No social distance, no wearing mask. Even where there is water, people just walk past it. They don't wash their hands. It's really scaring. The moment one person comes with this disease, we shall really get out of control. It will get out of control. The minister has warned, and I think she's going to run out of breath warning people to social distance, not to catch the disease. It should be our responsibility, because most of the people I see that don't practice these SOPs are adults who should even be careful. I find a lot of old people also mingling with others, and I suspect due to old age, some people already have high blood pressure. They have other organ failures like heart diseases due to old age. I find them in crowds and they are moving and they are not even wearing a mask, even when they have it. And so if we don't get careful, if we do not tell people the truth about this disease, it will run out of control. First of all, there's something I noticed, like every time I go to open a meeting, I first warn people about the disease. I tell them it is real. Then they call me and they say, do you know anyone who has it? Have you ever heard about anybody who has coronavirus? So it's like they are not even sure the disease exists. And that worries me most. Because if people are still doubting this disease exists, even if you don't have a TV, somebody, your grandchild or what, will tell you from social media that this is what is happening in other countries. So many dead bodies, people are being buried in mass graves. I was looking at statistics. Every day I wake up, I have got to know what is happening in the world. I was looking at what is happening in the US. 800 people died today alone, 850 something. In Brazil, about 950 also died today. India, the same story, 700 plus. It is really worrying. Imagine 800 people dying on the same day in Uganda. It's just because these people are far away from us, and we keep thinking it's not us anyway, it's not yet our turn. But we can't keep taking chances. The disease is real. The only thing I know is that it is so hard also at the same time to postpone an election. America has been debating postponing an election or having it. And I don't think they are taking a decision sooner than later. Because first of all, even if you postpone it, Corona is not going tomorrow or the other day. So if you postpone this election, then what happens? You will have to go through an election anyway at some point. And so one thing is we must be responsible people. The schools are locked down where there are children. Churches are locked down. Our children are at home. But then children get out to go and play with their peers. How are we going to control those ones? It's quite complicated, and it's just by the mercy of God that we haven't had a bad day yet. But otherwise, the people are not observing SOPs at all. And at all levels, adults, young people, I find a lot of young people playing football. I think people are getting tired. Even lockdowns. Remember at the beginning of the lockdown, a lot of people were very serious. People never got out of their homes. You could peep outside and you see very few people moving. The curfew was observed at the very beginning. But right now, even the curfew of 9 o'clock, I hear cars moving outside. Even when I was in Kampala, people were moving. The curfew was still at 7. But people were moving beyond 7, even up to 10. And I don't think all those who were journalists and doctors, they were ordinary Ugandans who had, I think, defied the curfew, because one time I called the police officer in charge of traffic and I said, is there still curfew? He said, yes, those people are just being defiant. So people are getting fatigued. And it's not here in Uganda, it's all over the world. in Germany, when they had asked everybody to stay at home and summer was beginning, people got out. In England, they threatened even to take police to beat up people who were at beaches and open spaces trying to catch the sun. It was very dangerous. They are very highly sophisticated people, but they wouldn't even observe the simple SOPs. In Australia, the Prime Minister sent dogs to chase people from some beaches because people wouldn't listen. Now Melbourne is back on a lockdown.
Honorable Margaret,
quite complicated everyone.
You talked about all levels, and I didn't hear you refer to yourselves, the politicians who are supposed to lead by example, and majority of the people, especially, it is worse even in the countryside. I came from West Nile just yesterday. I was in Nebi for 4 days, and I can attest to the fact that people are actually playing football. People are gathering, no social distancing. They even don't know what it means. They don't care. Majority of them say there is no COVID. They say we don't see it. But I want us to start taking our own responsibilities first. As politicians, can't you lead by example? You have seen from Arua to Western Uganda to Kampala to the east, the politicians have broken the operating procedures.
That's very true, Charles. Now, the biggest problem is really not with the politicians. Have you been to any market? Today I drove past a market, and what I saw is even worse than what politicians can ever gather. These marketplaces bring about 1,000 people. There is no politician who is bringing, I think, 1,000 people, sorry, 10,000 people. The highest number a politician can gather at a time is about 200, maybe 300 people. I passed a market today. I never saw anyone wearing a mask. There were hundreds of thousands of people in that market. I was going actually to my in-laws' place where we had lost an uncle. There were hundreds of thousands of people. And really, it's not about politicians. Politicians, I know, at least I am sure, everybody who calls a meeting talks about Corona, because we are very careful people. We don't want to have a pandemic in a very short time and we are to blame. But if you go to social gatherings, other social gatherings, especially markets and burials, because I know what government has tried to control is the churches, the schools that have been totally locked down. But the markets which have been opened, I am telling you, it is the next epicenter, markets.
Okay.
Because that's where they are the biggest gathering. And also funerals. You can't have the police chasing people everywhere. There's a place where they came to chase people from a funeral and people thought the police are mean-spirited. Because they were announcing, please go home, everybody didn't want to leave. So really, what should the police do in the circumstances?
Okay. Doctor, is COVID hard for us to, okay, let me put it this way. Have we copied too much of a Western kind of approach, i.e. especially social distancing, and that it cannot work 100% in our traditional cultural settings? She mentioned burials, and I can tell you, I was in Nebi in a place where an officer died, and I was shocked to see the magnitude of crowd flowing to the burial, majority without masks. And is it possible that social distancing can work? Or should we talk of physical distancing and then we say we can implement this, but social distancing we cannot?
Charles, social and physical distancing may be one and the same. What we mean is that you just keep your space 2 meters from each other and avoid contact. Our culture as Africans has been that we socialize a lot, and we want to have contact with one another, and our burials are usually huge. Our weddings are huge because you want to invite all the relatives, friends, and in-laws. But we are in a state that is not normal. The world changed overnight on the 31st of December 2019. And everyone should realize that it is not business as usual. It is a matter of life and death. So the question should be, if I don't go for that burial, will my presence be missed? If your presence will not be missed, do you really have to go there? Because you have to keep alive. From the very beginning, we developed guidelines for burials, for marriages, for the markets, for all kinds of places. And we gave guidance. We said, for the burials, let 50 people bury the dead. That is the most close relatives and the neighbors around. And then later on, after we are done with the COVID, we can organize Thanksgiving prayers, and we come back into our African culture, and everybody comes for the burials. However, the burials attract huge numbers of people, especially when people start the idea of cooking food and everybody comes together to have food. But we have to be people who are realistic, that coming together at burials, and sometimes we are even burying people when we don't know the cause of death. It is some of those things that spiked, the pandemic to blow out of proportion in some countries. If you recall what happened in Italy, people went for prayers, and it was a funeral service, and the rest is history. We also fear that the same can happen in Uganda. Social distancing is possible. We did it during the lockdown. We kept to ourselves. Right now, we can actually do it if we are determined to, with our masks on, with sanitizing and hand washing. We are only defiant. And I think because we have kept the numbers low and our death toll has been low, it has not yet sunk into the minds of the people that we have danger in the house. But the truth is, we have danger looking at us in the face and saying, I am here.
Can I ask it this way? Maybe we need to dig in deeper also into what the people are saying. What, from the statistics of the 10 people that we have lost so far, I've seen there is one of 41 years, there is another one of 40. With these people that we have lost, or is it as terrible as, strong people, completely healthy, and got COVID and died?
Well, Charles, it is well known from science that people with comorbidities or people with other underlying conditions will go faster. And from our statistics, the majority of our deaths are people who actually had high blood pressure or combined with diabetes. But we have also had cases of people who had HIV succumbing. But we have also had people who were previously healthy succumbing. So it depends on how aggressive the disease is in your body, and the comorbidities just facilitate it. So for me, my message to the young people out there is that we need to take precautions. Obviously, the elderly are more at risk. And in our statistics, we have a good number of elderly people that have also succumbed among these 10. We just need to be careful.
What is the oldest death case reported so far?
Among our people? 61 years.
The oldest we have had is 61. And the youngest?
27.
The youngest is 27. The one of 27, did they have any problem pre-existing that none or
No, none.
healthy?
Healthy.
Wow. Mr. Gobi, I was reading, Margaret referred, I think, to the US. By today, they have 168,000 deaths. 168,000 people who have so far died of COVID. And this is 7 months. 7 months, really, so to speak, from when it started, or 7 or 6. We still have 10, and hence probably the level of relaxation and carelessness. But Kenya next door is facing very similar situations like we are facing. They also have, politicians have also broken their own rules. In fact, the colleague of Jenna Cheng, I think he's called Ndegwa or Mutahi, something like that, the health cabinet secretary, last week was also under fire. He also went against the standard operating procedures. The president himself has gone against the standard operating procedures and addressed rallies where you see people without, people not social distancing, people without masks. And so what is it that we must do in our situation here, in your view? I know schools have still been closed, churches have been, mosques and churches have been closed, but what must we do to ensure that we safeguard the lives here and that we shouldn't lose people?
Thank you. I think number one is leadership. The leadership has to be in unison, sending a similar and well-concerted message to the public.
Message or acting?
You know, message and action go hand in hand. If you give a different message from the actions that you show out there, then you are a very bad communicator. You know, the non-verbals should move with the verbals, as you experts of communication tell us. But my biggest worry with COVID in many parts, not only here, but many parts of the world, is the misinformation.
The fake news.
Some deliberate, others out of sheer ignorance. Especially here for us in Africa, we've had this challenge now moving, because I think we're among the places where COVID has arrived late, relatively later, that we took it for granted that perhaps COVID is not for us. And you hear people saying it, that, you know, COVID is for some other people. Here we have good weather, we are eating well, and also, you know, we don't have certain conditions which are very fertile for COVID. This is going on. So even amongst very well-educated people, you find them going against what science has actually shown them. And they are telling you that as long as you are eating oranges, you will not get COVID. I hear a lot of this misinformation out there in the public. And you see people moving around with an orange. When you ask them, they say, COVID, you know, with this one, COVID cannot manage you, and so on. So I think leadership needs to be firmer, and also for example, these people who are violating the SOPs, what is happening to them? What's happening
Honorable Jen will tell us.
What's happening first and foremost to the politicians who are supposed to lead, especially those who are in government? I see a number of people who are putting on yellow, violating these measures with their supporters. I see a number of people who are not in yellow, who are in other colors, for them literally behaving as if they are immune of COVID. You know, you see people addressing crowds without masks. and they are aspiring leaders, and they are seated with them, and it's okay. But most especially those who are in yellow, it shouldn't be allowed that they go on violating these measures which have been put in place by their own government to really send that message to the electorate. But also you need to, Charles, realize that societal values are also there. I had the Honorable Margaret actually hinted on it that, you know, you can't stop lives completely. You can't stop politics. For example, we have to elect leaders. And these elections are always coming with excitement. We decided to have a scientific election, whatever that means. And some of the SOPs were read out on how we are going to conduct it. But I see this is now failing us to a very large extent, because we had avoided meetings, physical meetings.
Yes.
But now there are too many of them. Some of them are unnecessary. People are meeting a lot. And much as a few are putting on masks, and these are the social distancing and sanitizing and so on, in other places those things are just for formality. As you are coming in, as long as they put that thing, you know, in front of you, sometimes they don't even measure the temperature, you pass. You go and sit somewhere where another person has sat, there is no sanitizing of these surfaces and so on. So, to me, God is still the one who has been keeping us.
So the Americans, South Africans don't have a God?
No, I know they have a God, but you know, circumstances differ, and also the virus started from there, and it is now coming. We shouldn't be actually complacent that we are now okay.
Because our time is
to
coming.
me, I think we are among the you know, there are those fast movers in innovation and late ones.
Okay.
For us, we might be in for a shock, and that's why I'm always telling my own people, a few friends I have and others, just move only when it is necessary.
Okay.
If it's not necessary, stay where you are.
Okay. You mentioned masks. I remembered, Honorable, we shall come back after the break. I'll be asking you where the government masks are, because I haven't got one yet, and yet I was counted to get. I saw the number they said they should be getting. We are going to take a break right now. Honorable Ssemujju is around the corner. He will be joining us in the second segment. But the opinion poll question is that you can respond to and contribute to is, how best can politicians conduct campaigns without flouting government COVID-19 guidelines? How best can politicians conduct campaigns without flouting the government COVID-19 guidelines? Let me read it for the last time. How best can politicians conduct campaigns without flouting government COVID-19 guidelines? We are going to take a break now. Stay with us. This is Behind the Headlines. This is UBC.
government COVID-19.
The strides made in our field could not be possible without it.
Now we can watch our favorite show.
My radio is my best friend.
UCC provides an enabling regulatory environment and policy guidance for healthy competition. We also facilitate ease of doing this in the communications sector through licensing, standardization, spectrum management, tariff regulation, rural communication development, and consumer empowerment. An informed consumer is an empowered consumer. UCC supports local content and innovations. Driving the development of the robust communication sector in Uganda is Uganda Communications Commission.
Welcome back from that break. This is Behind the Headlines. My name is Charles Odongtho, your moderator, and we are looking at the political and social implications of COVID-19 on Uganda. And in the studio, we have the Honorable Minister, Minister of Health, Dr. Jane Ruth Acheng, and we have Mr. Ramadan Gobi. We have the Honorable Ibrahim Nganda Semuju. He has just joined us. He says he has been stuck in traffic for the last 1.5 hours and is Kira Municipality MP. Joining us all the way through Zoom from Fort Portal City is the Honorable Margaret Muhanga, MP for Burahia, and she is a panelist on this show. And before we went into the break, Honorable Ruth, one lingering question. I found people in West Nile, if you looked at the per capita of masks, you find like one person out of 10,000 with a mask. You can't see the mask. Actually, if you wear a mask, you look ashamed. That's how bad it is. Because people will ask you why you're hiding your identity, who you are hiding from, and why you think that, that the mask will protect you. So where are the government masks?
Well, Charles, first of all, your question calls for whether people have had enough education on the masks. We have tried our best to spread information about the fact that masks work and people should use masks. Yes, government committed to distribute masks to the entire population. We have had two challenges. One, the capacity of the producers to make enough masks per day so that we can get it out to the people. Building this capacity has taken a bit of time. They are beginning to pick up together with the local people to make the masks so that we can get it out to the people. Two is when the masks go out to the districts, there is another challenge of distributing it door to door. Even where it has been distributed, people don't put on the masks. And the complaint here is that it is not easy. Just look at all of us here. It looks like I'm the only one with a mask.
Because we are social distancing. Me, I have mine here because...
Even with social distancing, you must keep your mask on. What happens if one of us sneezes? We are in an enclosed place. You must protect yourself.
Which brings me to an important question. How should the masks be used and when and who? Tell us, you just clarify on that, because now you are bringing us to a new something else.
Children.
Ramadan and I had been told once you have the social distancing that safeguards you.
Not at all, Charles. You must keep on your mask social distance, and wash your hands. Now, the masks will protect you. If I have COVID and I don't have a mask and you have your mask, then if I sneeze, it won't get to you because you have covered some of the parts where COVID is transmitted. Similarly, the one who has COVID and has a mask will protect the rest of the population. So it is not only about one at a time. All the preventive measures go together. And we expect that children below 6 years will not put on masks, and adults above 75 years may not put on masks. But we also request that such adults are protected from coming out into the public. So such people should actually stay at home. Government so far has distributed masks to over 35 districts. And as the masks come, we distribute them out. As I told you, we have had a challenge of capacity, and we've had to mobilize the local people. But even where we have distributed the masks, as you clearly noted, people don't put them on. They keep them in their pockets, or they hang it around the neck like necklaces. And I saw a lot of this even in our parliament of Uganda. When people go to speak at the microphone, they pull the masks down. It is not supposed to be like that. You need to keep it on. It is not an earring. Keep it on at all times so that you protect the population and protect yourself. The distribution of masks may speed up now that the local women have come in to support. The population is huge, and at the same time, the same industries are also making the medical and the surgical masks. So it is divided labor to meet the needs of the people.
Just very quickly, those 35 districts, about how many do you estimate have already got? Or are they, the 35, are they fully covered? Entire
yes,
population?
They are fully covered, including Kampala. The challenge here is that the masks are distributed through government structures, and it is supposed to be door to door. It is the role of the local councils and the village health teams to get the masks to the people, because we don't want people to move. Now, sometimes there are difficult places that people may not reach, especially in Kampala. If you get a house within a fence, the local councils and the village health teams may not get there. Some houses have security that won't allow people to get in there. So we are encouraging them to target the marketplaces as well and get the masks out there to the people. But also some business areas like the arcades, like Chikubo, like the taxi parks, and get masks out to the people.
Okay. Honorable Ssemujju, I need to bring you in now, rightly so. I want to thank you for the privilege you accorded us to still come, even despite the harsh traffic that you had on your way here. We are looking at the political and social impact of the COVID-19 pandemic on our country, and the minister reported that today we got another death, and so we now have 10 deaths, and I think accumulated so far tested 304,485 by yesterday. I think today there should be an increase, an update. Now that's where we stand, but I wanted to start with you from the political perspective, how it is COVID is impacting your life, your political life, and especially the democratic space that you are supposed to operate in. How is it going for you as we talk? How would you describe it? I asked the minister and Ramadan and your colleague Muhanga a specific question. Are we losing the fight? What are those standard operating procedures that are working? What new procedures do we have to bring on board? Or is the fight too big for this country?
Thank you very much. First of all, I want to apologize to the viewers because of the heavy rains in the evening. It was almost impossible. I'd even asked for you to deliver my apology, but I was advised that you can continue battering. I am really very sorry. I usually keep time. I've been watching many international media platforms, and the debate from America to Europe is that it is increasingly becoming very difficult to enforce the measures that will stop the spread of COVID. Why? Because almost everywhere, complacency has set in. If you locked people in their houses for the first 2 months, 3, it becomes very difficult for you to continue locking people in their houses. That's why you saw the protests in America. They said we can no longer stay in the houses. You saw when they opened the beaches, it's as if there was no COVID in the world at all. So this has happened in America, it has happened in Europe, it has happened almost everywhere. I remember in one of the speeches the president delivered, he said, and maybe rightly so, that maybe in countries where the administrations, where there is limited freedom, let me put it that way, like China, it was easier to enforce these measures than in countries that are hugely democratic. Because in countries that are democratic, every measure is going to be discussed, you must justify it. You don't need to do that in China and maybe in the Middle East and many African countries. So that's the stage that we are at almost everywhere, that people are tired of these measures, and therefore you will have a fight if you want to continue enforcing them. As far as Uganda is concerned, we did tell our colleagues who are in government that it is not possible to have elections and social distance. And I was not surprised when I saw the minister responsible for the measures. The moment she announced, because she's been a very nice professional, politics will take away all that. So the moment she announced that she's going to join politics, I knew it was going to affect her professional performance. I was not surprised when I saw her with a mask on the table and in a procession, not as huge as the one of Aniti. So the trouble we have had because we did ask government, let us use the article of the Constitution that gives the president the mandate to declare a state of emergency. If we did that, then we will postpone these elections for the next 6 months as we continue waiting for the vaccine or for the treatment. Because every day there are announcements, progress has been made. So in our own calculation, we thought if we suspended these elections, if we stayed these elections for the next 6 months, maybe we will have the vaccine or the drug, the treatment itself, and then we can go and have our processions and minister. The minister responsible for justice and constitutional affairs, the Honorable Professor Ephraim Kamuntu, appeared before our Committee on Legal and Parliamentary Affairs with the Electoral Commission many times, and he said there was no justification that we should declare a state of emergency. And I was also not surprised when I saw him in a church. You've closed the churches, but you've turned them into venues for campaign meetings. So where we are now, the trouble we have, and I don't want to fault anyone, because what they are doing, I want to do, or when they don't see me, I do it. So I don't want to fault and blame. I think we made a mistake as a country to allow election. The president had said so, and rightly, that if the situation does not improve by July, we may have to think about these elections. I actually thought that by July he will announce that we are going now to use the provisions of the Constitution that allow us to declare a state of emergency, and then we can put elections on the side. The trouble I have is that while for me I am being arrested, the minister responsible for health is not even summoned to answer why she has violated her own. I saw police claiming that they have summoned my friend Honorable Anite There is another guy who resigned from URA, Kateshumba. I am not surprised that they have recorded a statement. I have been arrested twice. My people have been arrested.
For flouting the SOPs?
No. On the day I was arrested, for me actually I had on a mask. The policemen who came to arrest me didn't have. They looked ridiculous in the photographs that they were dragging someone with a mask and them didn't have. But they said, no, people are going to gather, and they were right in saying so. The only problem I have is that no solution has been found. We've just gone through the first phase of elections, special interest groups. It has been very difficult in many areas, at least in my area. My political party, the FDC, was unable to present candidates because I attempted to have meetings. The one in Chireka, I had put a tent of 50 people, but police came and carried away the tent and said, you can't continue. Yet, under the special interest groups, I was supposed to present 18 plus 5, 24 candidates per village. And there is no way you're going to select 24 candidates if you don't hold a meeting of at least 100 people. So these elections are going to be the worst election that we've gone through as a country. I don't know who I should blame. Is it the Electoral Commission or the government? COVID. Because I don't want to blame COVID entirely because we had a decision to make as a country and we didn't make it. So we have another phase of elections coming up. The local government nominations will start next month, and this is huge. In Chira, if you add all the councillors, there are now more than 200. So if each group is going to present 200 people, you need about 1,000 councillors, candidates. We have the NRM elections coming up. They will have to line up, and line up means that you will collect in one venue, all of you at the same time. There are villages in many parts of Uganda that are small. A village, a typical village in Chira, is more than 2,000 people. In Bukasa, where I stay, my village, the total number of voters is 6,000. So assuming half are NRM, and you need 3,000 people to be briefed so they can line up against or behind the candidates of their choice. So it is going to be extremely very difficult. And you know, these elections are emotion. I told someone that when people begin exchanging kicks and boxing each other, they will not remember that there is COVID. Yet that's where we are now. Yes, we've been affected because we cannot exercise the freedoms that are enshrined in the Constitution. You can't access voters' data, you need them. Even the meetings, I have held a few smaller meetings, but you want to run those meetings quickly so police does not find you. And even the politics itself has become extremely expensive. Things that I have never experienced before, transport refund. The moment you call a smaller meeting, people expect you to give them transport refund. For me, I've been addressing rallies. All that I carry to a venue is a public address system and maybe some small entertainment. Now you invite people, they sit in one place, you have to refund transport even if the meeting is held in their compound. So it's going to be very difficult, and that's why people are choosing the incumbents, that this is going to favor them. I am not sure it will, but it has, the COVID, the measures have impacted. I don't know if the minister will relax some of them, but they have impacted the doing of politics so heavily. We are now restricted at the headquarters, and yet you need to go and select candidates. I don't know. And for us who are in the opposition, it is even worse. Police, under normal circumstances, would be restrained to go and disperse an NRM meeting. You've seen even in ordinary life. I saw a market in Kawembe. It is not even by the roadside, it is in the road itself. But what they did was to bring posters of the president and put all around. So it will take a courageous policeman to go and demolish a market that is full. I saw people when they came to take over land, forest land in Chira. The first thing they did was to build an NRM office and put posters of the president. and then police will not come to so we are going to be affected adversely because police will not disperse NRM meetings. It is our meetings that are being dispersed. So far, no NRM person has been arrested. For us, we have been arrested. Even the media where we are supposed to go and address people from, it's not going to be easy. So we are in for a very difficult season.
Honorable Minister, the point that Ssemujju makes is related to what Ramadan said before the break, that the tough measures initially put in place were very effective. I remember at the beginning when some of your colleagues' families came from out, and the president stopped them, ministers, and the president stopped them from accessing the cabinet meetings and said, stay away until you are checked and that the Ministry of Health and the minister reports back to me that you are now safe and you've been tested, or even, you know, finish the 14 days. Can we really get back to enforcement at that level that we had? Is it possible? Or that has been lost and now we need to, like you said earlier, you know, twitch the measures a bit?
You know, Charles, in the beginning, when the pandemic started, everyone in Uganda was thinking about thriving, keeping alive at all costs. And everyone welcomed the measures. And the pandemic was our pandemic. The response was our response. That is the entire country. However, with the lockdown, there was a heavy toll on the people. And the minds changed from thriving to survival. And people were looking at what can I have in my pocket and how can I have food on the table. We even forgot that God has given us a lot of rain during this time. The wise ones have dug and they have a lot of food. Food is cheap right now in the country. However, people have moved away from fear because they have not seen the worst situation in the country. In our country, they have not seen it. Death to them was a rumor. It happens at the neighbor's house, not in Uganda. The high number of cases happens with the neighbors, not in Uganda. But as I mentioned earlier, we are moving to tough times. Unless we change our perception, we are moving to tough times. And reality will begin to strike. And people will actually beg to be locked down. Government has tried its best. We have spread information to every part of the country about COVID and about the preventive measures. And we continue. Right now, we are even tailoring our messages to reach out to target subpopulation groups, the taxi drivers, the people in Chikubo, the households, and so on and so forth, including those that are still under lockdown. In addition, His Excellency the President has appointed what we call a multi-sectoral technical task force that has 3 mandates: multi-sectoral coordination, enforcement, and compliance. Because one of the weakest areas right now is compliance to the measures. Not because we are not able to, but because people are not willing to. A lot will have to take place, including some penalties. In the statutory instruments, which we have been signing, there are penalties if you don't adhere to the standard operating procedures. And the penalties vary from some payments, including being locked up. I am hopeful that when the multi-sectoral task force spreads its roots down to the grassroots levels. Some of these measures will remind people. But you see, with a public health event, you don't want to try force first. You want to try to educate people to understand why they need to do certain things. It is only when they refuse, when they adamantly refuse or they are defiant, that then you have to apply force to protect the rest of the people. Ugandans know why we are requesting them to implement these measures. They do know it. But right now it is about survival. And I don't know how we can address survival because they want money. The economy has gone down. He talked about the economy. I don't even understand why everybody wants to flock to the city. The city itself doesn't have business. Nobody is buying clothes.
They're looking for survival, like you said.
But what is there that they are looking for? Survival, but it's not there. Whichever direction you turn, there is no business going on. Not only in Uganda, it is actually the entire world. So we just have to learn to live with what we have as long as we have food on the table. And that is why I was saying there is more wealth in farming right now, but the wealth is having food on the table because you won't sell the food anyway. Nobody is going to buy it. It's cheap.
Honorable, have you tried, as the scientists, have you tried to find out what the 10 or so countries that have never reported any COVID at all? I see, but most of them, apart from North Korea, most of them are really... North Korea is not reporting.
It's not possible, they will report.
Anyway, we have Kiribati, Marshall Islands, Micronesia. These are really countries. Some of them you hear for the first time. Samoa, at least that one I've had before. Solomon Islands, Tonga, Turkmenistan. This is in near Russia, I think. Tuvalu, North Korea. These countries have never reported any case of COVID. What could they be doing? Or is it like Semuju is joking that...
Well, there are countries that have just refused to report their statistics to the World Health Organization.
So they are living with it?
They are living with it. Some of them are implementing measures to prevent it, but they don't want to share statistics with the rest of the world.
So you just don't cooperate with the World Health Organization, and then it will stay as if you don't have it. But it is most likely they have.
Definitely.
As long as their people travel and all
Definitely.
that kind of thing. Interesting, interesting. Earlier on, I announced that the opinion poll question that we are getting questions and comments on is how best can politicians conduct campaigns without flouting government COVID-19 guidelines. And there are a number of comments or questions that have come. I want to read some of them, if my producer can bring them online so that I can read some of them. We are right now entering into the last part of the discussion. Producer, if you can bring the comments coming from the listener or the viewer out there. Those comments and the questions will be brought, and then I will read them. Mr. Gobi, going forward, one of the things you said is that enforcement must be done. But is that the only way? Some people have said, like, I think the US is doing, Trump in his own stubborn way has insisted we must live with this. From a social or economic standpoint, really this economic in your view, Do you think that COVID is an unfortunate occurrence that the world should accept, the world of business should accept to, move with and bear the burden of calamities?
COVID is real, but also poverty and starvation is real. What we don't need is to create a situation where the population has to choose the style of death, either to die of COVID or to die
hunger,
of
starvation
or poverty, either way. And the world over, they are trying to look at how to balance this. And this balancing act now is the reality, which is going to show, to separate leaders from leaders. And I think in Uganda already, the government has relaxed the measures to allow some businesses to operate. And they have reopened, but as you know, economy, there's nothing anymore like Ugandan economy. It's not there.
It is a global.
It's a global economy. When out there, economies are not working, in America, in the UK, in the US. For example, in America, they gave people about $2.7 trillion
in stimulus.
In stimulus, to survive, yes. to say that you go and buy food, you go and restart your business, you go and...
Even Kenya,
what people did
in
the US? They picked that money, government gave them, and went and deposited it in their accounts. Now, yesterday, the Financial Times reported that in the US, in the last quarter, banks have registered $5.5 trillion of fixed deposits.
That's in the US?
In the US.
But the same is happening here. Tell us about our station. Bank of Uganda reported last week that savings, fixed, especially fixed type, increased from, is it 5 trillion
to
about 8.2. Tell us why that is so. Are these people who are, who are supplying COVID materials to Dr. Jane's sector and the like, who are getting good business, or is it people who feel, I can't run business, let me save?
Everybody has entered into a wait-and-see mode, everywhere in the world. Because, COVID, unlike other shocks, economic shocks, whether supply side or demand side, is quite unprecedented. The only time you can compare it, to is around World War II, since World War II, when the entire world was going down. Because now there is no alternative market to invest this money. If you have your, for example, like now, I'm sure youth and other people out there are saying, why doesn't government give us some money and we invest in our small businesses? But which business are you going to do now to make money?
Certainly tourism is off.
It's not only tourism, just even these people opening shops in town, they will tell you there is no business. Why? Because, money is a circular flow of income and expenditure. If someone does not spend money because, one, either is social distancing, like now bars are not open. Those bars are a way of, is a catalyst of money moving around. When bars are closed, you will not find the people who are selling chicken selling.
But they're selling behind the bars.
Whatever, I don't know.
Go around and
I don't know how much they really sell. If you went and asked,
maybe volumes have reduced.
If you went and asked the brewers what has happened, they will tell you the real story. Some of us who are economists, we speak to them. They actually they keep on calling. What's happening? How do we get out of this? Everybody is puzzled, and as a result of that now, there is a lot of uncertainty. People have decided to keep whatever money they have for that unforeseen future. What is likely to happen? Like now, fees The president told us that we shall decide around the end of August whether we shall have a dead year or we can reopen a few classes, candidate classes. So that can now keep people in waiting on whether they should spend the fees or they should keep it. And as a result of that, the economy goes into this wait and see mode. And this is what is affecting the entire, economy at large. Yeah. But what I wanted to add on is the need to minimize the socio-economic consequences of the COVID. As we social distance, as we contain it. We need to minimize this act of balancing the two. This is where the leaders are in trouble. The decision makers in the cabinet and even those who are legislating. How do you ensure that you don't allow the virus to really get to community level, to start affecting our people? Because, as you know, our country, I don't know how many beds we have. The minister just talked of these ICU beds, which can keep someone alive for some time. But even we have found that they are not very helpful, even in countries which are so sophisticated.
Because the numbers just overwhelm the...
Even when the numbers are not overwhelming, people are dying on those beds. In the US, in Italy, they were dying and they had these beds. So I wouldn't want this situation to come to a level where my people in Butambala are also having a problem of COVID and they are being taken to a center 2, a center 4.
And the health centers, the health workers will run away. And
the health workers, have, like they did in South Africa, they ran away and abandoned the hospitals. So I wouldn't want to see that. And yet also, I don't want to see government stopping us completely from living our lives. For example, stopping younger people from doing some business to survive. Because the reality is, for you to live, to stay in Kampala, you must pay rent. And the government has not found a solution to that. Even the businesses which were locked down are going to pay rent for the period when they were under lockdown.
They were not producing, they were not
making money, but government has failed to
rein in the...
To kind of having a conversation with these landlords. I would want to see which solution can be found in there, such that people can now become less anxious that, what if my business fails completely? Where will I start from?
But that solution is supposed to be between you, the people who advise these business people, and the legislators like Semuju. I think we should get maybe probably his view, and Margaret Muhanga, and of course Honorable Acheng. How do you talk to a person, a landlord, and tell them that please forgive a person X who is your tenant because they have not been working, and you expect that landlord to pay their loan?
Even if they don't have a loan, you see,
who should bear the suffering?
Under the lockdown, people continue meeting their financial obligations. You go to a taxi, you pay. You hire a trucker, you pay.
Or you walk.
You just have to respect the housing sector. People who have invested in, you can't, as government, except if you found money to give them. There is no you're going to tell them. I saw my colleagues in Parliament. It's because there are many people who are tenants. It will make you a popular leader when you said they should forgive rent. They can't. And for me, I can't join that. If government wants to ease the burden of people who are renting...
But, Honorable, there was a suggestion by the landlords themselves. I remember very well because I was involved in these conversations. The landlords were saying, if government can give us 3 months of tax holiday after lockdown, they give us those of
tax holiday, not tax waiver.
we are, you know, even the holiday, you are just...
You see, Ramadan...
They are saying, give us 6 months, in other words, the 3 months of lockdown, and extra 3 months, we can give rent-free period to the tenants.
See, Ramadan,
3 months.
all what you are saying has not happened. I saw Bank of Uganda at one time issuing a statement that they are going to speak to the Bankers Association, they are going to reschedule people's loans. Some banks did, but the interest went up. I met a lady in Chireka, she was paying 900,000 before the lockdown. After the lockdown, they told her, we have rescheduled your loan, but you are now going to be paying 1.2. And she said, I was struggling to pay 900,000. Now they tell me, we have, you can now pay, if you are supposed to pay in 1 year, now you can pay in 1 year and a half, but you will be paying 1.2.
Which increases
so
the amount.
The moment you say rent, the thinking is of people who are renting in arcades in Kampala. But there are small, all sorts of people who have invested their daily income, their regular income is from renting out houses in Chireka, in Waise, everywhere. So the moment you begin speaking about rent, you're not addressing only commercial buildings in the state center. You're talking about the whole housing sector. Unless government, and even government will not find money, because you see, the moment the businesses go down, even taxation will go down. So government is looking for money, it doesn't have, but that's why teachers are now crying. I don't know how many teachers I have met who can't pay rent. Even feeding themselves has become difficult. I met a teacher in Charwajara who is now making bricks. So these are not easy questions to solve for a smaller, poor economy like ours. And I saw it in the parliament. Now don't pay water, now don't pay electricity, now. And I thought we were taking a wrong direction. Because the moment you begin suggesting waivers, there are people in arcades who have continued working even under lockdown. All they did was to negotiate with the security people. You just come and they open for you, you go and work. So I thought we'll leave this, I don't know whether that's what the economists call the rule of demand and supply. But try to get government into solving each and every problem created by COVID, we're going to be in trouble. Okay. So I do not support the idea that people whose business is renting out houses should make a loss. If government can find money, I have no problem. But to say, if I have borrowed money, if I have made all my savings and put up a smaller house in Chireka, and then you tell me for 6 months I should not charge people, either you are sending me to steal. So this is a matter that can be solved by government, not by the individual landlords.
So whatever the suggestion is, government can only be the one to take the final decision by coming in and sorting out both sides.
In fact, tenants should be running to government, not landlords. They should be running to government for a solution. Because the individuals who have put up arcades in Kampala and everywhere, this is their business, this is their income. So you can't simply close the tap and tell them, please, people have not been working. They have loans to pay.
Okay. I'm told the network for the lines for the public to engage through is now right. My producer is bringing me the responses to the poll question. Can we read them, and then I bring in Honorable Muhanga and Mr. Ramadan to ask the Minister and the Honorable Semuju questions. Omutakama Koleb says, considering scientific campaigns, Zoom, webinar, and SOPs, he hasn't. The statement is not complete. Sorry about that. Let's go to David Opondo through Facebook. He says, moderator, ask Minister Acheng why they keep those districts under lockdown and continue allowing truck drivers to go to those districts infecting people. The last part I'm not sure about, but the doctor has taken note of Opondo's question. Alex Bariamujura says, hope people will remember wearing masks when death toll clicks 100. That's what we are all not hoping for, but I can see your fear and warning. That's a warning to all of us. Abdullahi Abdi Ashur says COVID-19 is different from HIV/AIDS. This is a harmful disease which spreads through air. So we can't live with it. Thank you. I think that's a response to what I was asking, whether we can live with it. Kiseka Patrick, through Twitter, he says, locally they can use community radios, but since these radios may favor some political figures more than others, it's better to conduct these campaigns without gathering people, probably just a drive through the campaign areas. Is that possible, Honorable Semujo and Honorable Jane, that you just do a drive past? Tony Kent Chaze on Twitter says, patriotism will have to take its place in the players' hearts. If we love our country, all that's needed to safeguard it is possible. No one should be above the law. Everyone is a prospective candidate for COVID-19. That's so true. He says all Ugandans can stay safe by abiding by the directives. Honorable Minister, you can respond to those, especially the first one. There is another one on Twitter by Bills. He says, by practicing care for the people and also as a society, we must push back on these politicians to say, look, when we get sick, you will receive best care and we shall die. That's another one, I think, talking about the cost of medical care and response that some people can afford and some people may not. Honorable Doctor, maybe you can respond to some of those. And then in our culture here, we have a culture where the panelists ask the guests a question, and so after you have responded to some of those that you have picked from those questions, then I will bring in Ramadan and Margaret Muhanga to ask you our guests' questions.
Well, thank you very much. What the population need to know is that Uganda is a transit country. And being a transit country, it feeds all the East African countries. So the trucks actually crisscross through Uganda. And at the beginning of the pandemic, it was quite challenging because stopping the trucks would mean denying one of the countries food or the basic necessities. But we found a way out, and we started testing the truck drivers at the border points of entry. So to date, we do not allow in any positive truck drivers, so there are no truck drivers infecting anyone. However, through the efforts of His Excellency the President, working with his colleagues in the East African region, and the chair of the East African community, we have had a number of engagements. And we have had support from Trademark East Africa, and we now have all the East African countries testing at point of origin, meaning the truck drivers from Kenya have to test from Kenya before they even make an attempt to come to Uganda. And all this is an online system, so as you're coming, we are able to view your results in the system and only allow in the negative truck drivers, but also track them throughout the country. We track both the driver and the cargo, wherever it is going. Obviously, that does not mean that some truck drivers may not turn positive while in the country. So we also carry out what we call random tests at the points of rest. And up to date, I must say that this system has worked very effectively, and we are not worried anymore about the truck drivers. Rather, we are worried about the community infections that are within the country. Now, about the elections, there are very innovative young men who have come up with a number of applications that can be used by politicians during campaigns. There are applications that help to spread information about the candidate. There are applications that can take whatever candidates want to give to the local people up to the local people. There are applications that use mobile phones. So what somebody was saying, that if we are actually interested in keeping our country safe, we can do it, is very possible. We can do it. There is nothing impossible. It only takes interest and determination. Obviously, people will say some of these applications are expensive, but with the COVID pandemic, elections are not going to be cheap. Even when we talk about meeting not more than 70 people, and you look at a parish, Honorable Semuju was saying only one of his villages can have over 2,000 people. If you are to break them down into 70s and give all of them transport refund, I don't know whether it is affordable. The population will also have to adjust to the new normal and know that not all of them will be engaged, but once the information has gotten out to you, you're free to choose the candidate of your choice. So briefly, I think those are the questions that I needed to respond to.
Okay, there are some others that have come online, some that I picked. Someone says, I am watching from Chingola in Zambia. And then Chris Bariomunsi, I think your colleague, says, I'm streaming live from Entebbe. And then someone called Felix says, Honorable Minister, is it true that Israel has got the vaccine? Maybe you need to add Russia. I saw something about Russia and the whole tension with other issues of protocol on developing vaccine. And then someone has said, Otto, someone called Otto, said, good pictures, thank you. Thanks so much, Otto, for appreciating. And then another person has said, probably responding to Ramadan, he says, the bars are open well past midnight. We usually operate. Honorable Minister, respond to the person who is asking whether it is true that Israel has got a vaccine, and then the case of Russia, so that then we can go into the last part of the discussion, the segment of answering a question from Margaret and Ramadan.
Well, Charles, I must appreciate that from the outset, the international community invested a lot in the manufacture of vaccines. But manufacture of vaccines is not a simple process, and it does not take a short time, because the vaccines themselves have to go under trial, even trial in humans. The only vaccine that is currently in phase 3 trial is the one that is being worked on by Oxford University in collaboration with AstraZeneca, and probably being manufactured by Serum Institute of India. The rest of the vaccines that are being declared have not gone through all the 3 phases of trial. Now, that is for the scientists to decide whether we need to use those vaccines or not. But the World Health Organization will always give guidance. It is risky if something is not scientifically proven to be safe for use in human beings. And so we'll wait for them to give guidance as to whether we need to go in for the vaccines made by Russia or the ones made by Israel, or wait for the ones that have undergone all the 3 phases of the trial. However, there is also caution here, because while the vaccines are being worked on, there is also scientific evidence that the vaccines may not be protective for a long time. The antibodies may not hold for so long. So if the vaccines protect for 2 months, 6 months, is it worth it? All that will have to be based on scientific evidence. So what I want to say is that a lot still needs to be done in the area of vaccines, but we are hopeful. Even Uganda has joined, you know, in the vaccine manufacture and trials. We are hopeful. Perhaps by December, we will have vaccines that have undergone all the phases and are more reliable.
Perhaps.
Perhaps by December.
Okay, good. Honorable Margaret, you have heard. We can keep hope alive, but it's time now. I need you to be the first to ask the Minister and Honorable Ssemujju questions. Honorable Muhanga, go for it.
All right, Charles, I would like to ask Ssemujju Uganda that what if government had said we hold these elections? Wouldn't have because there was a school of thought that the elections should not be held this year and we may wait for some time. But I want to ask Ssemujju, if the government had decided not to hold these elections, would you have agreed or would you have gone to the opposite side as usual to oppose what government has proposed? And then I would like to ask Dr. Jane Luther Cheng how hard or how easy it is to find both the medicine and a vaccine for especially viral infections. From ordinary people that I hear say it is not easy to treat viral infections. Like they say viruses, unlike bacteria, are harder to treat. So is it so easy for the countries that are trying to find a vaccine to get a vaccine that can really contain this pandemic? Or are they going to get a vaccine which they will keep giving us doses for some time? Because like polio, like measles, people get doses at any age for those infections.
Okay, let me start with Honorable Ssemujju to respond to his, and then Dr. Cheng.
The idea of invoking the article of the Constitution that gives the President mandate to declare a state of emergency.
That's Article 110.
Is an idea that we formally presented. How then could we have turned around to say that this is bad? Because we presented formally in writing, but also verbally in Parliament, even to the Electoral Commission. Let me tell you, at the beginning, now the minister wants us to maybe to be frightened. Everybody at the beginning was frightened. Along the way, you government made us believe that maybe it is not as bad as we thought. Because even in the Parliament, the minister, Professor Kamuntu, responsible for justice, came and said, there is no need to declare a state of emergency. You're going to find it extremely hard to ask the population to observe the measures and to be frightened when your messages are conflicting. Because the moment you make a declaration that it's not necessary to declare a state of emergency, you create an impression that things either are getting okay. Exactly. So when we begin experiencing the deaths that are happening, you will find it very difficult to return us to the mentality that everybody had. Let me tell you, the day you announced the lockdown, I never left my house for the next 3 days. It's as if COVID was at the gate. I went buying beans and everything and stayed home. The first time I ventured out was after 3 days.
I almost stayed out inside the house for almost 6 days,
yes,
without getting even to the gate.
So that's how we felt at the beginning. The moment we got out and saw that actually COVID is not at the gate.
It is not on the road.
Yes, it's going to be very difficult to go back to those levels of alertness. I can see the messages from you and from government continues, but it's going to be very difficult. So Margaret, yes, the direct answer is that although you think that we just oppose for the sake, we don't, because we made a proposal that to be able to save ourselves from COVID, we may need, even the president himself, before you ask me that question, ask the president. He said in July, if things are bad, in July we'll have to take a decision about elections. And when July came, the decision was that we can have elections.
Okay. Doctor, your question.
Yes, my question, my answer will be very simple, because she asked how hard or how easy is it to find vaccines or medicines for viral infections. And the truth is that it is extremely hard. Although some vaccines for viral infections have been gotten, like measles, chickenpox, rubella, and so on and so forth, but sometimes the viruses change their antigenic composition. And then, you know, the scientists have to be at it. But even for the other areas, like for bacteria, it is similarly not easy. It takes time because, as I mentioned before, trials have to be performed when vaccines are made. Now, we have not even succeeded in getting a vaccine for HIV, which is also a virus.
Which is also a virus.
Up to now. Although we have gotten some medicines which can prolong life. So in short, it takes time, and it requires a lot of work, a lot of research by the scientists, and a lot of investments. But for COVID in particular, the international community invested a lot. However, it is now 7 months down the road. We are hearing about the vaccines, but we are not seeing the vaccines that are, you know, being approved by WHO and them telling us that right here now you have vaccines, or these vaccines will be for life, or, you know, you can use it for 6 months. So it is still a bit of time before we get there, and we are really sure. It is not an easy job.
Some World Health Organization expert, I think a month or two ago, said that like HIV, which is also a virus, the world should prepare to live with it, that we might not see a vaccine in the foreseeable future. How true could that have been?
Well, I don't want to dispute that statement, because to date, the influenza vaccine that we have only lasts 1 year. And some of these coronaviruses that cause common cold and so on are very challenging, you know, for us to have the vaccines. So even as the scientists are struggling, the best way forward is actually for us to learn to live with COVID, but to learn to protect ourselves.
Good.
Because it will be with us for a while.
Ramadan, your question.
And I will start with the Honorable Minister. Honorable Minister, as a technocratic leader who has to urge for very strict containment measures to save lives, what has been that hard moment, one of your hardest moments, to have your colleagues in both camps, that is on the health side, the technical side, and on the political side, especially in the cabinet, to understand the balance needed in the fight against COVID, and what is that right balance between the science and the politics?
Go for it.
What has been one of my hardest moments to make my colleagues understand? definitely the answer is glaring at us. It has been this political season. Many of the colleagues would want to adhere, but the argument here is that the electorates want to feel them, they want to see them, they want to hear them. So they want to interact with them. And for you to be chosen by people, they need to understand you, to feel you, and to see you. Just like Honorable Ssemujju Nganda has been saying. And many people think that the preventive measures are, blocking us from doing this. However, there is no cost that you can attach to life. There is no activity that you can say supersedes life. Life comes first. And people have to understand that in going out to carry out political campaigns, you may end up losing your life yourself. And so even when I am talking to my colleagues, I make this very clear, that you need to protect yourself and protect your voters. It doesn't make any sense, neither political or economic or a life sense, if at the end of the day, all the lives are lost. So whom will you lead? Imagine if you have a mass death in one of the villages due to coronavirus, and that village is full of your voters. Doesn't make sense.
But isn't it also true that for politicians, winning an election is also a matter of life and death, and it is a matter of survival?
I think that one will be answered by Honorable Ssemujju Nganda.
That is something the viewer should also think about. Please, ask Ssemujju your last question.
Honorable Ssemujju, even in the most livable countries in the world, the big democracies in the world, for example, in Norway, I heard that they are legislating a law called the Corona Law to give more power to government. Do you think, in your honest assessment, that coronavirus has extended more power to government in Uganda? And how?
You see, first of all the measures that we are consuming, and that's why people are calling them government measures. And even the enforcement of the measures, it's still on the side of government. In fact, it's not only in Uganda. Some time back I wrote an article that the strong men of Africa are now going to be using COVID measures as a cover to do many things. Right, the government must exercise some power for it to, first of all, to announce, but also to enforce the measures. The only problem I have is when COVID becomes also a cover for many other things. If you come to Parliament, money must be found very quickly because of COVID. I remember when the debate started with the food. For me, it reached near a quarter of my constituency. There are other constituencies in Wakiso that didn't see it at all. Then they came for masks, and I highly doubt that they will reach everybody. Now, we were told the radios will come. I don't know when. So yes, government rightly assumed more power, but part of that power is being abused also. If you've seen the conduct of security, if you've seen the pressure on Parliament to approve money, so when the accountability is done, and I hope it will be soon, we realize that we ceded too much.
Okay. Ssemujju, your last message.
I have told everybody in my constituency that COVID is real. I don't want to abuse leaders, but people who have behaved recklessly in Brazil, they have caused their population a very, very big problem. So I don't want to pretend here that please this is okay. It is not okay. Let us try to protect ourselves.
Ramadan, your last message.
My last message is simple. to all Ugandans out there who have been watching us. If you want to continue watching us, even next year or the other month, make sure that you adhere to the measures which were put in place by the government to ensure that we overcome this pandemic. It is real and it is killing people. And even if you don't die, your life might never be the same again if you get this disease. So the best treatment is to avoid it.
Honorable Margaret Muhanga. Honorable Margaret?
Yes, please.
Your last message.
We really need to get a little more serious. As leaders, we must lead by example, but also try to avail the population with the necessary requirements to avoid COVID spread. Because if it enters the communities and we have 50 cases within communities, it will be very difficult to control COVID the way I see the societies in Uganda behaving, both culturally, and most of it is out of carelessness, because there are places where we can avoid going. Nobody forces you to go to a social gathering unless it is about your livelihood, that you're going to work, make money. But if you're going for leisure and pleasure, I think we can avoid going for such gatherings.
Thank you. Finally, Honorable, in your last message, kindly also include what he has mentioned, that even if you don't die, if you get infected, your life will not be the same again. Touch on that.
That's very true, sincere.
No, I'm asking the doctor now.
Yes, unfortunately, many of the people who suffer from COVID and get either moderate or severe disease have complications. And the complications affect nearly all the organs of the body. And your life can never be the same again. And so the people need to know. You see the picture of people with mild COVID dancing in the wards gave people a false perception that you can get COVID and you are just okay and you will continue to live your life. But when you get down to this real science and you see the multi-organ damage, you would not want to get COVID. And so my message to the people is that we have the knowledge, we have the information, and we have what it takes to determine the direction in which this pandemic will go in Uganda. My hope is that we shall choose to prevent it from spreading, limit the numbers, and keep it under control. If we continue to remain defiant, we will live to have many regrets in our lives. Government has put in place very many measures. My appeal to all of us is that we adhere to the preventive measures and stay safe and stay alive. I thank you.
Thank you very much. I want to thank you all out there so much too. But the message that we must leave you with, we are not yet out of the woods yet. We are very much there. We are within the danger area. And so don't rejoice. It's not yet Uhuru, as they say. COVID is here with us. It has no cure. It can kill. So it has killed the young. It has killed women. It has killed men. It has killed the old. And so we should take it seriously and protect ourselves. Only go out if you must. Ensure that you keep safe. And that's the message we are leaving you with. Thanks so much, Dr. Ruth Acheng, the Minister of Health and a candidate in the new Lira City for the women there on NRM ticket. Thank you so much, Mr. Ramadan Gobi. Thank you so much, Honorable Semuju. Although you came late, we still are privileged that you found time to come and join us. And of course, thank you so much, Honorable Margaret Muhanga, all the way from Fort Portal City. Honorable Abdul Katuntu is listening to us, is watching. We wish you a quick recovery and pull out of that small fever or something without any big problem. To you out there, first of all, thanks to the technical team that ensures that we bring you this show behind the headlines here at UBC. But most importantly, you who sits out there to listen and to watch this show, and to especially those who participate through the messages, the questions, you make it interactive, and that's what this show must be. Thank you so much. God bless you. Until next week, bye-bye, and take care. Stay safe.